Jasmine and welcome back to my YouTube channel. So in today's video, I have a really highly requested video. So I'm going to tell you guys exactly how I study for pharmacy school using concept mapping. And concept mapping is essentially where you just map out your ideas on a paper, but I'm going to show you guys how I do that for a pharmacotherapy exam or how I study for pharmacy school. So if you guys want to know more about me, my lifestyle in pharmacy, make sure you guys like, comment, and subscribe. Also, keep watching to learn more about how I study and a little bit about heart failure. Thanks for watching, y'all. So before we get started, I want to have a brief disclaimer. So I am a pharmacy student. I am not a licensed pharmacist, so I'm not a provider yet. So this information is just for studying purposes only. It's not intended for any clinical guidance or any guidelines on how to treat a patient. So just keep in mind, this is only for studying. Don't ask me about medications for treatment regimens because I am not a pharmacist yet. What exactly is a concept map? So a concept map basically lets you outline different ideas about one major topic. So in the case of pharmacy school, it's going to be one disease state. So in today's video, we're going to talk about heart failure a little bit. And just to keep in mind, this is a brief overview. It's not as in-depth as you should go. But yeah, so with concept mapping, we're going to focus on basically 6 main topics with one disease state. And again, today we're going to talk about heart failure. Okay, so first things first, the number one thing you want to focus on, or the first thing to focus on, is the pathophysiology and etiology of the disease state, because that's the basis of all the things we're going to talk about in the future. So right now we're talking about heart failure. On the screen you can see that I have a graphic about what the pathophysiology and etiology should look like. So with heart failure, you want to focus on 3 major things. There may be more things to think about, but again, this is an overview of heart failure. So the first thing is volume overload. So with these patients, we will talk in the future about some signs and symptoms that are associated with volume overload. We also want to think about, for pathophysiology, the RAS system, or the renin-angiotensin-aldosterone system. And at this point in studying, I would, if I didn't know what the RAS system was, because it is so heavily related to heart failure, I would potentially watch a YouTube video, try to find some information within a textbook chapter, just so that I can know the overall background about the RAS system. And the last thing that I would do is think about neurohormonal activation or activity, because things like epinephrine and again the RAS system can have an impact on heart failure and its presentation in certain patients. So it's also important to think about etiology, or the cause of this condition. And most commonly, heart failure is associated with chronic, often untreated hypertension or undertreated hypertension. So these are the things that we want to keep in mind with pathophysiology and etiology, so that we can begin to think about the disease state as a whole. Okay, so the next thing we want to think about in relation to etiology and pathophysiology are the signs and symptoms that are consistent with heart failure. So there is a such thing as different types of heart failure. So you can have left ventricular heart failure or right ventricular heart failure. So it's also important to note that you have to know normal physiology when studying for pharmacy school. So normally we have to know that the right side of the heart is supposed to pump blood to your lungs to get oxygenated, and the left side of your heart is supposed to pump systemically or throughout the entire body. So that's really important to note. So if a patient does have left ventricular heart failure, that means that the left side of their heart is not working as it should be. So with this, you want to think, okay, if the left side of the heart is associated with systemic function, but the blood is coming from the lungs, if you decrease the amount that the left ventricle is functioning, you're going to have some backup within the lungs. So some signs and symptoms associated with left ventricular heart failure are things like rales or sounds within the lungs, pulmonary signs and symptoms including like dyspnea or tachypnea with lower oxygen saturation. So think about things that impact the lungs when you think about left ventricular heart failure. So with right ventricular, if the lungs are impacted with left, it's important to know that people with right ventricular heart failure will have some more systemic or peripheral signs and symptoms. It's important to note these things and relate them back to the pathophysiology of that disease state and the physiology, because we kind of talked about the normal function of the heart. So as you can see, when you're studying, you want to interloop things, make things click in your brain, so that ultimately you can create a story within your brain and have a picture of exactly what's happening with these patients. Okay, so one of the next things we want to focus on is diagnosis and classification of heart failure, or whatever disease state you're talking about. So I know that as a pharmacy student, it's not our job to do diagnosing, and it's not our job to determine what's happening with the patient. That's more of an MD or a medical student's job to determine the exact cause of the problem or the exact problem. It's more of our job to focus on treatment. However, you can't effectively treat a patient if you don't know, number one, the different classifications of their disease state. So how severe the condition is, or different things like that. It's also important to note that if you don't know how diagnosing works, you won't know how to read the medical record to determine which medications work best for that patient. So it all ties in together. So we do have to know about diagnosing. So for patients with heart failure, it's important to note that we focus on ejection fraction, or how much blood is actually being pumped out of that heart, even though it's not working as effectively as it should. So there are two different types of heart failure. There's one called HFpEF, or heart failure with preserved ejection fraction, and we also have HFrEF, or heart failure with reduced ejection fraction. So it's important to note these two differences because treatment can be a little bit different for these two. And it's also important to note that we have more guidance on treatment with HFrEF, or reduced ejection fraction. So with heart failure with preserved ejection fraction, or HFpEF, it's important to note that we have greater than or equal to 50% ejection fraction. It's also important to know that patients with heart failure with reduced ejection fraction, 40 is the number. So you have to have less than or equal to 40 for your ejection fraction percentage to be, I guess, considered HFrEF. So going along with diagnosing, it's important to classify the stage of disease that the patient is at, or the stage of heart failure in this example. So for patients, it's important to know how do we classify them, and how do we choose the stages. So with heart failure, I am cheating a little bit because I do have my notes here because I can't remember all the acronyms, but we do have the New York Heart Association functional classes, and that's simply based on symptom severity. And we also have the AHA, yes, and ACCF guidelines that help you know what stages of heart failure the patient is in. Okay, so before we talk about treatment options, it's really important to note that pharmacists should know the goal of treatment, or why are we treating this patient? What do we hope the end result will be by choosing certain medications? So for patients with heart failure, some things that we want to consider: we want to reduce the risk of mortality, or we want to prolong life. We also want to make sure that they have decreased symptoms, so their quality of life improves. But these are all things to consider when you choose medications. So goals of therapy is really important. Okay, so now we're going on to the fun part, or the part that's more associated with being a pharmacist. So it's important to always note non-pharmacologic treatment options for patients. So what are some ways that we can help them reach their goals without actually giving them a medication instantly? So it's important to note, for this example with patients with heart failure, we want to pay attention to diet. So we want to make sure that they have less than 2 grams of sodium per day, and that can be really difficult. So we want to give them some leeway and explain that it may be really difficult to adjust, but there are some methods that we can use, including that includes the DASH diet. So we also want to make sure that we focus on exercise, but things that are heart healthy exercises. So walking every day. You don't have to encourage a patient to instantly start running. So these are all things to think about with non-pharmacologic treatment. Oh, and what's also really important with heart failure to think about. So you know how we talked about earlier, patients with right ventricular heart failure can have some peripheral swelling, or some swelling within their arms and legs and things like that. We want to make sure these patients monitor their weight, because if they don't, they won't know how much fluid they're retaining in their periphery, and we don't necessarily know how their heart is doing. So with these patients, we want to make sure they monitor their weight and let their doctor know if there are any drastic changes. So as you can see when studying, you want to make connections. So make connections between the pathophysiology, the signs and symptoms, and the non-pharmacologic treatment. That way you know exactly how to treat a patient and what to do for heart failure. You see, we're starting to put the pieces of the puzzle together so we can actually know when we get to a patient case what to do next. Okay, so finally, we are on the medications or pharmacologic treatment for heart failure. Now, this is the note. As a pharmacy student, you need to know these medications in and out. And right now, we're not going to talk about the ins and outs. So with these medications, for heart failure as our example, you always want to know what is the backbone of therapy, or what do most patients take, and what's guideline recommended for patients. So in patients with heart failure, I always think about ACE or a beta blocker. So a patient is either on an ACE, which is a hypertension medication, they're either on an ARB, which is a hypertension medication, or they're on a beta blocker. Actually it's ACE-ARB plus beta blocker. So with these patients, that's basically the baseline of treatment. And it's also important to know cardioselective beta blockers, or beta blockers that have an impact on your heart. So with these patients, you can be on metoprolol succinate. So I think succinate is for swelling. You can be on bisoprolol or carvedilol. And these are basically the cardioselective beta blockers for these patients. It's also important to note for treatment that as patients progress throughout their disease state, you want to add on more medications. So there is an algorithm within the guidelines, and it's always important to use guidelines when doing concept mapping, especially with the medications. So for different caveats or different patient scenarios, you can add on different medications. And their potassium is less than 5. You can start them on spironolactone, which is a potassium-sparing diuretic. So you want to use diuretics for these patients because they may be a little swollen or they may be a little puffy. So you can use that if the patient does not have hyperkalemia. You always want to think about if the patient still has a heart rate after you have an ACE or a beta blocker. If their heart rate is above 70 after these medications have been started, you can add something called ivabradine. If the patient is Black or African American, you can start hydryl nitrites or isosorbide. Also, it's important to note that if the patient is doing well on their ACE or their ARB, you can switch them to something called an ARNI, like Entresto, and that can be used for these patients as well. So it's important to know different caveats with treatment and when to add on different medications when you're studying for different disease states for pharmacy school. So today we talked about concept mapping and the steps that you can use to concept map for studying. So concept mapping is an amazing way for you to get an idea of exactly what you need to know about the disease state and how you can learn this information to apply to different medications to treat patients. So concept mapping is really awesome. It always helps me study. But the last thing to note is you always want to make connections. So it's important to make connections between the different areas on the concept map. And sometimes it's even helpful to draw arrows. Like, for example, for patients, the pathophysiology may be volume overload. So with these patients, we may have some swelling or some edema. So it may be helpful to draw an arrow on your concept map to note that these things are connected and this is why the patient is presenting in this manner. So it's always important to make connections when concept mapping because connections are the key to remembering this key information with the disease state. So as a student pharmacist, it's really important for us to know these medications inside and out. And concept mapping is really good for pharmacotherapy and knowing when to treat a patient and how, but it can lead to you not studying the medications like you need to for a pharmacy school. So there is something called a drug table that I could discuss in my next video. So if you guys want to learn more about drug tables and how to actually study for medications as a pharmacy student, let me know. But today's video was just a brief overview using the example of heart failure for how I concept map for pharmacy school. Again, this is a high-level overview. It's not all the things that you should know, but it does give you a blueprint for what you should study when you first learn about a disease state. So for me, I typically start the module or start the disease state with the concept map, and as I learn more within my class time, as I learn more with reading, I add more to the concept map. So this is just the beginning. I know it seems like a lot, but this is exactly where you should start so that you're on a good path before your exams for pharmacy school. So thank you guys so much for watching my video today. Today we talked about concept mapping, but I could do more videos about how I study for pharmacy school. Just let me know down below. So thank you guys so much for watching. Make sure you guys like, comment, and subscribe. Bye, y'all.